Actually, this is a very great question, and the reason is mainly toxicity, because many chemotherapies, they directly attack the DNA of the cell. They break up the DNA, and when we use the chemotherapy is treating all over, circulating in the blood. Therefore, it does not only attack the lymphoma cells, it can attack the regular bone marrow cells, making the patient neutropenic and increased infections. And some patients even die from chemotherapy because of the low blood counts from the chemotherapy, secondary infections and all that. But even long-term, this is the short-term acute toxicity. The longer-term toxicities are secondary malignancies. Sometimes after one prior line of therapy, maybe as high as 15 to 20% of the people who lay in remission for years to come, because the DNA of the normal cells was also attacked with the chemotherapy, so years later they have a therapy-related secondary malignancy. Some of them are very fatal, and they could be lung cancer, there could be MDS, could be leukemia, could be pancreatic cancer. So the toxicity is just too much. The chemo-free therapy are mainly targeted therapies. They target not directly on the DNA, but usually target a cell component. For example, I target the brutal tyrosine kinase inhibitor is one of the best chemo-free therapies ever developed. So chemo-free therapies, a lot of people think, well, chemotherapies are very tough and very effective. And how about the targeted therapies? The targeted therapies, although they are oral, oftentimes, although they are used alone, sometimes one single pill could be matched the several drugs with chemotherapy. So not only the toxicity is the issue, the efficacy has been much dramatically elevated, improved with the targeted therapy and their rational combinations. Therefore, we both for a better efficacy and to stay away from the toxicity, and especially the long-term toxicity, we advocate chemo-free drugs, chemo-free agents. Treating the patient with chemo-free has long been the dream of all hematology oncologists, and we are so lucky that we have so many chemo-free agents to use.